Well, this December 1st is World AIDS Day, a day about raising money, increasing awareness, and fighting prejudice about the disease. Close to 40 million people have been killed by AIDS since it was first discovered 3 decades ago. But today, an estimated 35 million are living with the disease. Well, for more now on the situation, I'm joined by Dr. Gundo Weiler from the World Health Organization. Thank you for taking the time to speak to us, Dr. Weiler. Now, in recent days, there have been encouraging statements from some NGOs, with one of the biggest saying we've reached the beginning of the end of the AIDS epidemic. What medical advances have there been exactly, and are we closer to a cure?
Yes, there is indeed a lot of reason for optimism. First of all, we have to acknowledge that a huge progress was made really over the last years in scaling up, in particular, access to treatment. There are now probably more than 14 million people who've got access to life-saving antiretroviral treatment, and which is a huge achievement. There was a target set for the world to reach 15 million people by the end of next year, 2015, and this is really one of the targets that indeed we are going to meet. So that is good news and huge progress. Now, at the time, we thought 15 million is enough, but now the science has moved on, and we know that if we achieve much higher coverage in antiretroviral treatment, we indeed have an opportunity to break the epidemic.
So when you say break the epidemic, are you in agreement with the UN that's saying it will eradicate AIDS globally by 2030?
We are talking about the elimination of the AIDS epidemic as a public health problem. It's probably not going to disappear completely, the virus from the planet, because we have a lot of people who live with HIV and who will receive treatment and care in a chronic approach. There is no cure around the corner, but we can control the infection amongst those who already live with the virus, and we can do a lot to prevent further onward transmission of the virus. So indeed, if we talk about 2030, we can reduce the number of people dying from HIV from currently 1.5 million per year to 300,000 per year, which would be a great achievement.
Dr. Weiler, today there is some 13.5 million people around the world that have access to AIDS drugs, which is a dramatic improvement over the 5 million who were getting treatment just 4 years ago. What more can be done to make sure the people with HIV are getting the medicine they need, and what are the populations that are the hardest to reach?
Yeah, there are two issues, indeed. First of all, an issue, whom do we not reach with treatment? And we see that uniformly across the globe, there are a number of populations that are paradoxically most affected by HIV, so-called key populations that include people who inject drugs, sex workers, men who have sex with men, or transgender people, so who are most affected by the epidemic, but who have least access to services. So this is really the consequence of behaviors that often take place hidden, that groups that are often persecuted in many settings, and that find it difficult to access mainstream health services. So we need to really strengthen our service delivery approaches and the environment, the policy environment in countries, so that these groups have much easier access to treatment.
Dr. Gundo Weiler, thank you so much for taking the time to speak to us. You are with the World Health Organization in Geneva. Thanks to you, and thanks to all of you for watching France 24. Stay tuned.